Well, good afternoon, everyone. Today, I would like to review our state's successes and our challenges related to COVID-19. And given the growth of cases in the United States overall, I want to review how we can preserve the progress that Illinois has made. It's been over 4 months since I first stood here and delivered the first of more than 80 COVID-19 briefings. An awful lot has happened over that time. In the last 4 months, the people of Illinois have once again proven themselves to be the most resilient, dedicated, and compassionate people in the United States. To put some perspective on this, Illinois now has the lowest infection rates among all of our neighboring states, between 1/2 and 1/3 of their positivity rates. Indeed, we have one of the lowest positivity rates in the country, and it's because of the individual actions of millions of our residents. Throughout this pandemic, I have always given you the facts about coronavirus and how we're doing in the battle against it. Let me begin by saying, first and foremost, this virus has not gone away. It's still infecting people, and it will likely continue doing that for months to come. But with the difficult truth comes the news that Illinois' ability to manage COVID-19 looks a whole lot better than it did at the beginning. Unlike in late February, we now have significantly greater capacity to test for the virus and to trace the contacts of those who test positive so we can limit the spread of the infection. Ours was the first state in the nation to be able to test for COVID-19. Now, Illinois is hitting a record weekly average of more than 33,000 tests per day, crossing the 2 million test threshold earlier this week. Today, we report testing of 38,161 people. Our state testing is among the best in the nation, and we have tripled the number of contact tracers that we had just 6 weeks ago. In the first 2 months, our 7-day rolling average positivity reached over 23% at its peak. Today, we're averaging 3%. Illinoisans worked hard to get our numbers down so that we could build back some aspects of everyday life in relative safety, moving through the phases of Restore Illinois over the last few months. For over 2 weeks, all of Illinois has been in phase 4 of that plan. And while there can be adjustments to allow greater flexibility for businesses and individuals, we cannot reach phase 5 until we have a vaccine, a very effective treatment, or the elimination of new cases over a sustained period of time. That said, many people want to know if we're out of the woods, and they're wondering what's next. So I'm here today to outline the path ahead and make sure that we all know what will cause us to impose further mitigations. First, opening up our economy does not have to come with a spike in cases. Other countries have done it successfully while reducing cases and infection rates. But that requires vigilance on the part of all of us. It's imperative that individuals, families, workers, and businesses follow the recommendations of doctors and epidemiologists, that we act quickly if we see any outbreaks and upticks, signs that could lead to a surge of coronavirus infections. Our guiding principle remains the same as it has been from the very beginning: keeping people safe and healthy. The virus is unforgiving, as we have seen in states in the South and the West. So it's important when we see trends in our data that indicate a potential problem in any region of Illinois, that we need to start tightening mitigations in that region before it's too late. The epidemiologists and professionals at IDPH have determined that we need to take action in a region if we see a sustained rise in the positivity rate, along with either a sustained increase in COVID-19 hospital admissions or a reduction in hospital surge capacities. A sustained rise in the positivity rate is defined as an increase in the 7-day rolling average for 7 days out of a 10-day period. In addition, if any region hits 3 consecutive days of an 8% average positivity rate, that will require action, period. These metrics are clear. Staying under these metrics will allow us to continue in phase 4 without having to take significant mitigation steps. At the end of the day, job one is to keep you and all the people that you love safe. We're also today changing the boundaries and the number of health regions in Illinois. Unlike when we first introduced the Restore Illinois plan at the beginning of May, our growth in testing and tracing has given us a much more surgical ability to manage outbreaks and address problems locally. So going forward, we have the ability now to monitor and measure progress in 11 separate regions, based largely on our 11 hospital emergency medical services regions, referred to as EMS regions, that have traditionally guided IDPH in its statewide public health work. For ease of management of this coronavirus pandemic, we've redrawn some EMS regions, but left most of the regions as they were. For example, the city of Chicago will be in a region of its own, as will suburban Cook County. As for the collar counties, we've shifted regions based on geographic contiguity. For example, Kendall and Grundy counties will now be in a region that is not part of the collar counties. Remember that the goal of the regional lines is in large part to make sure that there is healthcare availability. This plan lays out an array of mitigation strategies that can be applied if a region breaches the resurgence metrics. These mitigations cover categories like bars and restaurants, meetings, social events, religious gatherings, and organized group recreational activities like adult and youth sports. In each category, we have 3 tiers of mitigations, allowing us to move carefully but deliberately, depending upon the severity of the situation, to control the spread of the virus while continuing to allow a region to be open to the greatest extent possible. These mitigation options allow us to move decisively without reacting more broadly than circumstances require. We're focusing on detecting and mitigating localized outbreaks by working with municipalities and counties to take targeted steps to contain outbreaks. With our new mobile testing units, greater testing capability, and increased contact tracing, local public health departments working with IDPH have been able to limit community spread in a number of those circumstances. Unfortunately, outbreaks are taking place consistently and in every region of the state. In just the last few weeks, we've had outbreaks tied to athletic camps, July 4th parties, and churches. As I said yesterday, bars remain another concerning source of rising positivity rates in various regions. As we've seen concerning trends, it's been important to me to sound the alarm with local officials who can take immediate targeted steps before we intervene at the state level. For example, I reached out to the mayor of the city of Chicago last week because of the concerning uptick in their positivity rate. I'm also deeply troubled by outbreaks that we're seeing all around the state tied to activities like youth sports, like in Lake Zurich, where dozens of students and parents have tested positive in a related outbreak, and in Knox County, where a teen softball league is also experiencing an outbreak. Remember, the degree to which we can reduce risk and restore aspects of our daily lives is still unfolding. We're continually evaluating what works and what doesn't work. And we're taking a good hard look at how youth sports fits into that conversation. Let me reiterate what I've said from day one. IDPH and I are ready to take immediate action there and elsewhere if trends in the data require it. Looking ahead, I know that many people have concerns about in-person learning in schools. As a parent, I share those worries. Every school district is different. Different building sizes, different flows of students across campuses, different numbers of students and teachers per square foot. One size doesn't fit all. So the Illinois State Board of Education recently released guidelines for how districts can return to in-person learning. There's room for adaptation to local circumstances in the guidance, but there are some requirements that must be adhered to. For example, face coverings, distancing, and classroom capacity requirements. In every decision relating to this viral threat, schools must focus on giving our children the best education possible while offering the greatest consideration to their health and the health of their families and all of those who work in our schools. And as indicated by the ISB instruction, hybrid schedules and remote learning are likely to be a part of that solution. Parents should be fully engaged in understanding what policies each district is moving toward, and should be fully included in discussions of how to adapt to local and individual needs. But to be very clear here, any district that intends to disregard this guidance is gambling with the lives of our children, teachers, and families. Districts that don't live up to public health guidelines and standards and don't make a genuine attempt to protect their communities from this virus could be held liable in the courts by community members who are ill-affected. I'm a father. I understand that parents are worried sick about having to choose between seeing their kids miss even more in-person schooling at critical ages and the very real threat of this virus. Good people with good intentions can disagree on how and when kids should go back to school. But let me be clear, I wouldn't let my own children return to a school where masks are not mandatory, and serious effort hasn't been made to keep students distanced during the day. This should not be controversial. Remember, the degree to which communities can mitigate risk and restore more normalcy to daily life in the months ahead is, to a large extent, in the hands of the people of our state. Taking precautions, following the mitigations recommended by doctors and epidemiological experts, like wearing masks in public places and keeping some physical distance, are necessary for us to keep all Illinoisans safe and healthy. Throughout this pandemic, it's been my priority, shared by Dr. Ezike, IDPH, and the rest of my administration, to ensure that Illinois would not be too proud to evolve our path forward if new information encouraged us to do so. 2 months ago, when I introduced the Restore Illinois plan, I said, we can and will make this smarter as we move forward. And we're doing that today, as we have all along the way. Scientists and doctors and researchers learn new things about this novel virus every day. That fact should humble us. There's a difference between learning by questioning and sneering in the face of facts. And in this moment, as we face down a global pandemic, as our communities struggle with massive economic upheaval it has brought on, and as we renew our call for racial justice, when it comes to the unknown and the uncertain, now is a time to err on the side of compassion for our neighbors and empathy for the most vulnerable among us. On that note, I want to end with a renewed call to action. The research and science are much clearer about COVID-19. There are things that we do know and we know work. 216 studies of mask wearing and distancing have been evaluated, and they collectively confirm that masks and distancing bring down transmission rates and the risk of infection. That is a fact. The single best thing that you can do to help our state, to help your neighbors, to help your community, is to wear a mask in public. So follow Dr. Ezike's 3 W's. Wear a mask, watch your distance, wash your hands. You can also help in another way. If one of the 1,450 contact tracers calls you, please answer. Also, in Illinois, everyone, regardless of citizenship status, who needs to be tested should go get one. Our state-run community-based mobile and drive-through sites are free of charge to anyone who shows up. Private insurance and Medicaid-covered families can get tested at other locations at no cost as well. On top of that, anyone listening who has a device and an internet connection can help too. We provide county-by-county data on the IDPH website that will allow you to monitor how your local community is doing at reducing coronavirus spread. That allows you to spur action by your local elected officials to provide additional mitigations to reduce your local infection rate and keep you and your neighbors safe. Everyday Illinoisans with an interest in ensuring your neighborhood is seen safely through this pandemic can use this tool to hold your local officials accountable. Illinois, this journey has not been easy. Coronavirus has ravaged families, made many people sick, and has killed more than 7,000 of our fellow Illinois residents. Not a day has gone by where I haven't wished for a magic wand to rid our people of the pain, the loss, the trauma of the last few months. But the virus is still here. Ignoring it, trying to wish it away, is not going to help us beat it. A quixotic rush to regain a shadow of our former lives today will just delay a real return to normal later on. When you go out without a mask on, host secret parties, stuff your bar or restaurant to capacity despite the warnings, ignore common sense in your worship practices, it's not a political statement. You're hurting your neighbor who is desperate to keep their business open, or your friend who has an immunocompromised child who has been inside for months, or your parents who don't have the same defenses against this virus that you may. This isn't about politics or campaigns. It's about the people that we love and care about in our own communities. Here is what I know for sure. We've seen some success, however relative, while other states are seeing surges, because the people of this state show up for each other, show up for science, show up for our doctors and nurses on the front lines, and show up for your community time and time again. That should give us all great pride in Illinois. We need to keep showing up for one another now more than ever. So thank you, and I'd like to now turn it over to our IDPH director, Dr. Ngozi Ezike. Doctor.
Thank you, Governor Pritzker, and good afternoon. First, let me just start off by saying that there is no more ardent supporter of the success that we have enjoyed in Illinois with respect to this coronavirus than our leader-in-chief, Governor Pritzker, so thank you for your tireless efforts. And second, a point of clarifications regarding the 3 Ws. There's not mine, it's ours. I saw it out there, and I think there's importance in widespread messaging that we all use the same terms. And so I saw that and said, yes, that's a great thing, and I want not just our state, I want the country to hold on to the washing our hands and wearing the face coverings and watching our distance. So if I were to make my own, I think I could inartfully come up with something. C's, the 3 C's, cover your face, clean your hands, and the last one's a little bit harder, count your 6 feet of distance. But the fact is we are still in this pandemic. No one asked for a global pandemic to rock our world, to steal our loved ones, to totally upend what's normal. No one asked for our daily routines to be disrupted. Nobody asked for our summer, as what we used to know as summer, to essentially be canceled or significantly changed. But the invisible enemy persists without a vaccine and without an effective cure. So yes, we stayed home initially and we made it very hard for the virus to find people to infect. And that was so key, and that's why we are sitting on the success that we have. That's why we have the lowest positivity rates for any states in our region. Less people infected meant less people hospitalized. We went from having 800 individuals lose their lives in 1 week to having under 200. And of course, 200, under 200, 150 is still too much. But please appreciate that significant decline. Our positivity rates have come down. Our hospital admissions for COVID are lower than what they were months ago. And no matter where you go online, again, other people are sharing different facts. Illinois is always on that small list of states that's trying to get it right and maintain that. So that's great. But here's the kicker. As we opened up and graduated into phase 4, that meant that more people were out and about. And what does that mean? That means there is the greater chance of getting infected. Remember, we still don't have a vaccine or a cure. But the deal was that as we go out and try to get back to some level of normalcy, that we would have the mitigation strategies in place. And those were the 3 W's: the face covering, washing our hands, the watching our distance. So I thank all those who have been adherent to those 3 W's, but we need more uptake of this, and we need more participation in this key measure that is supposed to help us fiercely guard the successes that we have seen in Illinois. As the governor stated, there are multiple, dozens and dozens of reports just this week of outbreaks from a myriad of different activities, from house parties to sports, to churches, to travel, to hotspots outside of the state. But I also want to highlight the who of many of these new cases that we're seeing. Please be aware that young people, again, breaking off the age ranges in deciles, ages 10 to 19 and ages 20 to 29, they are having higher case rates now than ever before in this pandemic. We are following this very closely, but young people and parents of young people, please be aware. This virus is now being spread by youth, by younger people. So young people, we need you to make responsible decisions to help us continue to keep our successes and decrease and minimize spread. And of course, parents, as additional support and leaders for these young adults, I pray that you will assist and guide these teenagers and young adults to make the right decisions, as everyone's decisions affects all of us. So looking at the numbers for the day, since yesterday, 1,187 new confirmed cases were reported to IDPH, which brings our state total to 156,693. Unfortunately, 8 deaths were reported to IDPH, which totals 7,226 deaths lost to COVID since the beginning of this pandemic. Again, as of last night, 1,454 individuals were reported to be hospitalized with COVID, and of those, 324 patients were in the ICU and 130 patients on ventilators. Our goal of increased access to testing is continuing. In the past 24 hours, 38,161 tests were resulted. And earlier this week, we crossed the 2 million test mark. We are reporting out more and more test results because more of you are getting tested. And maybe more of you are getting tested because you have identified exposure risks. Important reminders as we are out and trying to live our lives. We cannot control this situation without masking and distancing. We cannot. Number 2, if you learn that a friend or a relation or a contact of yours tested positive, you have to undergo a 14-day timeout. You need to wait at least 6 to 7 days after your exposure to get tested. because that's a better chance of actually showing a positive test result. If you find out a day after you got contacted by your friend that the day before they were positive and you were with them just that day before, it's too soon to get a test. So please, a 6 or 7 day window after your exposure is the ideal time to get tested. But even if that test is negative, a negative test does not buy you out of the 14-day timeout. I know that's hard to take. You're feeling fine. You got an initial test. It says you're negative, but that test is not enough to take you out of the 14-day timeout. We have many individuals that have not been positive on day 6 or 7. Up to 30% of people might still test positive or develop symptoms on day 8, 9, 10, up to day 14. So in the interest of not spreading it to other people, we have to do that 14-day quarantine. Also, if you have a positive test and you don't have symptoms, you still have to isolate for 10 days. Not having symptoms does not mean that you're not infectious and does not mean that the test was wrong. And to help the general process, please, we have to be vigilant. Keep track of where you have been and who you have been around. In the event that you do test positive, that you can help identify as the contact tracers reach out to you, as you even take your own personal responsibility to reach out to those who may have been exposed. Make sure you notify your employer, your social networks, your family networks, your religious groups, your sports groups. Please be a responsible citizen and share to people who may have been exposed in case you get to them before the contact tracers do. Cases are increasing across the country, and even in some areas in Illinois. With our local health departments, we are aggressively identifying outbreaks in Illinois to control them before they spiral out of control. I continue to salute my team at IDPH as well as all of our local health departments for their work since the beginning, but it's not over. So outbreaks are identified in several different ways. Local health departments can identify them through case investigations, and that's why it's so critical that the public cooperates with our contact tracers. When they call, we need as much information as you can provide. We're still ramping up the number of contact tracers, so we're going to have even more people making these calls, and we need your help in giving them complete information. Facilities may contact the health department to report that a group of individuals have tested positive or have symptoms that are concerning. And then IDPH also looks through our many data sets to identify different clusters. We want to identify as much as possible. We need to know where it happened, who was involved, how many people, where were the likely exposures. It can be, as mentioned, within sports settings, bars, restaurants, factories. We've seen daycares, any place is possible. Local health departments in consultation with IDPH will recommend control and outbreak response measures, which include quarantining of the close contacts. That's the 14 days from the exposure to wait and see if symptoms will occur. Testing plans are shared and improvements are needed to prevent transmission with infection control procedures in place. A few weeks ago, we announced the arrival of Phase 4, which was a testament to how well we as a state responded to this pandemic. We did it together, and we are still needing to work together to get through this. The 3 W's will lower the spread of the virus. That's incontrovertible. The important actions and sacrifices today will directly affect what school looks like in the fall. So we all have a hand to play in what our future looks like. Please bear any inconvenience that you think is associated with wearing a face covering. Bear that inconvenience to prevent much larger inconveniences down the road. I implore your support. I implore you to follow the 3 W's. I implore you to take care of your fellow resident here in Illinois. Thank you. And now a summary in Spanish. Gracias, Gobernador Pritzker, y buenas tardes a todos. Realmente todavía existe esta pandemia. Nadie pidió una pandemia mundial robando las vidas de nuestras familias, cambiando totalmente lo que es normal. Nadie pidió que nuestras rutinas diarias fueran cambiadas. Nadie pidió la cancelación del verano. El enemigo invisible persiste sin vacuna y sin un cura. Repaso, nos quedamos en casa haciendo difícil que el virus encuentre personas para infectar. Eso fue muy clave. Menos personas infectadas, menos personas hospitalizadas. Murieron menos personas. No importa dónde vaya en línea para obtener sus datos, Illinois está en una lista corta de estados con una positividad menos de 5%. Qué bueno, verdad. Pero aquí está el problema. Abriendo significaba más personas afuera y más oportunidades para que las personas se infectan. Recuerda que todavía no hay vacuna, no hay cura. Pero el trato era que seguimos usando una cubrecara, lavarnos las manos y guardar nuestra distancia. Gracias a todos los que lo hicieron, pero necesitamos más participación con estas medidas simples. Para los números del día, en primero necesito decir que necesito compartir quién de los nuevos casos que estamos recibiendo. Los jóvenes de 10 a 19 años y de 20 a 29 años tienen casos más altos ahora que nunca antes en el curso de la pandemia. Estamos vigilando esto, pero a los jóvenes y los padres de los jóvenes. Tenga en cuenta que este virus ahora se está propagando entre los jóvenes y necesitamos que los jóvenes tomen decisiones responsables para bajar la propagación de COVID-19. Y ahorita para los números del día. Desde ayer, 1,187 de casos nuevos está confirmado a IDPH y desafortunadamente 8 muertos han sido reportadas en las últimas 24 horas para un total de más de 7,000 muertes por el estado de Illinois. Hasta anoche se informó que 1,454 personas en Illinois fueron hospitalizadas. De ellos, 324 personas fueron en ventiladores, estaban en la unidad de cuidados intensivos y 130 pacientes estaban en ventiladores. Recuerdos importantes. No podemos controlar esta situación sin cubrecaras y estar físicamente distanciados. No podemos. Si sabes que su amigo dio positivo, tienes que aislar por 14 días. Espera hasta 6 o 7 días después de su exposición para hacer la prueba, pero si es negativo, no puede salirse de la cuarentena hasta 14 días. Si tiene una prueba positiva sin síntomas, debes aislarse por 10 días. Mantenga un registro de dónde ha estado y con quién ha estado, en el caso que está positivo en el futuro. Los casos están creciendo en todo el país, en algunas partes de Illinois. Con los departamentos de salud locales, IDPH están identificando agresivamente brotes en Illinois para controlarlos antes de que se crezcan fuera de control. Doy gracias a nuestros departamentos de salud locales y por el estado por su trabajo desde el primer día de esta pandemia, pero no ha terminado. Por favor, aguante cualquier molestia asociada con el uso de una cubrecara para evitar molestias mucho mayores en el futuro. Por favor, nos podemos hacer eso juntos. Muchísimas gracias. And with that, I will turn it back over to Governor Pritzker.
Thank you. Thank you, Dr. Ezeka, and happy to take questions from members of the media.
Governor, you said that if there is this sustained positivity rate of 8%, I believe is what it was, right? Over 3 days?
Yes, if we spike to it, that's what that's meant to be. It's a fail-safe.
What is immediate action? What are the consequences?
Well, again, there's a menu of things, and I talked about some of them in my remarks. For example, and I mentioned yesterday, bars as an example of something that would certainly be, it's a thing we look at. We've seen studies of the spread transmission that can take place if bars are overcrowded. And often, even though there's been a capacity limit of 25% put on bars, they are not following the rules in many cases, and there's transmission. That's one example. Another example is youth sports. We've seen this summer just some examples I talked about. And so those are among the menu of items you heard me talk about. But let's not focus on the 8% fail-safe number. This could happen much before that. In other words, the menu of items that are mitigations are about the numbers moving the wrong direction in a sustained period of time. That doesn't mean it got all the way to 8%. It could be that a region is moving very quickly upward, but doesn't reach 8%. But over a sustained period, 7 days of 10, the 7-day average positivity is moving up. That is a trigger, along with the availability of hospital beds or the increase in hospitalizations. So those are, I know it's complex, but we wanted to lay out for you and be very transparent about what the triggers are, what we're looking at. I've said to you all every day, I wake up and look at these numbers on a daily basis. I look at the rolling averages of these numbers, and so does Dr. Ezeka, and we're constantly evaluating and making decisions about what is it that we may need to do. Long before we ever get to those points, as you heard, I call local officials, or Dr. Ezeka speaks to the local health department to say, there is a problem in your county. What are we doing? How can we be of help to you? What are you doing about it? Local governments have the ability more immediately to do things than state government does, and so we encourage that. But where state government needs to step in, we do, and we will.
To what degree do you think the reversal in numbers you're starting to see is a matter of people just becoming complacent, or is it simply Illinois being an island in the middle of these spiking numbers in neighboring states?
It's an excellent question. You are right on. We ask that question of ourselves too, because when you look at areas like St. Clair County and Madison County, right across the river from St. Louis, Missouri has I forget the exact number from Missouri, but I think it's around a 7% positivity rate. Ours is 3%. So if you live in that area and you're traveling across the bridge to Missouri, you're essentially doubling the possibility that you will, could contract this, or at least the number of people that you end up in front of. It's very important for people who live in those areas to be aware of following mitigations that we've suggested in Illinois. In other words, making sure you maintain your distance, wear your face covering, even if it isn't required in the state that you're going into. That you want to protect yourself, certainly. You hope that people there will be protecting you. But so we worry about the border areas and people who come over the border. Some people live in Illinois and work in a state that's bordering Illinois, and they every day go back and forth. And that doesn't mean that they're in any greater danger as long as they're maintaining distance, wearing a face covering, washing their hands, following the mitigations. So that's one thing. To what degree is this about complacency and people just deciding that, I'm done with this? Look, we worry about that, of course. And I think you see that there are young people. I don't know whether they were following mitigations earlier, but you often see young people going to bars or just, gathering in large groups, having parties with one another, not thinking that either that they're vulnerable or that they could be carrying it to someone who is vulnerable. So we worry greatly about that. That's why we have a lot of social media. It's why we've done outreach to organizations all across the state to make sure that people are paying attention. And then I can't help to mention that there are people who view this as political, that wearing a mask is, and keeping your neighbors safe is political. It's not political. This is just about caring about your community and about people you love.
To follow up on the young people, and this might be better for Dr. Ezike.
Sure.
The statistics that the city released today show that by far the largest group of new cases were from the 18 to 29-year-olds, 30%. Can you tell us on a statewide basis, are you seeing similar things, and how does that age group compare with previous data?
Right. So I will say that we've made tremendous progress with our long-term care residents, which are obviously a much older population, and so that used to be a very significant driver. But in the recent weeks, we have seen that the 20 to 29, and again, we have so much data, and when you break it out, it might be the case for, I think, non-Hispanic whites, 20 to 29, that's the largest group. Then you also had that in blacks, 20 to 29. But then you've never seen this high rate for the 10 to 19. That is new in terms of the numbers climbing over time. They're now at the highest rate that they've ever had from the beginning of this pandemic. So.
What is that rate?
I can't remember all these numbers off the top of my head, I'm sorry, but I can make sure that they get that to you. But as we follow over time and as we follow the total people who are being infected, who are now being infected, we are just seeing that there's a new shift in where the burden is lying, and that's why we're trying to elevate that. And we have a youth forum that we're working to try to solicit input from young people, because we need to understand what they need to have to make the best decisions. Is it that they don't understand that they can infect and go on to infect others? Do they really think that they can't get sick? Because we do have many examples of young people without comorbid conditions. Do they understand that if they are infected and have a history of smoking or vaping, that could portend a much more serious? So we want to make sure that the young people actually have the information. Maybe it got mixed when we talked about elderly people in the nursing homes and they thought maybe they were somehow immune. So we want to correct the narrative if it was misunderstood and make sure we get them the right information.
I don't mean to hog here, but just 10 to 19, that would suggest, even though a lot of focus has been on bars, that would suggest an age group that, of course, can't be in bars. So where is the source of this?
So that group, I have teenagers, right? They've been on lockdown, but they are complaining that their friends are out and about. And so kids are congregating.
Or social action?
Yeah, social actions, social gatherings, home get-togethers, trips that are not sports, that are not involving, masking and distancing.
So how does that portend for schools?
Well, we know that if schools are to happen, there has to be masking and distancing. But to get there, we have to not have widespread community transmission at rates that are not sustainable to even safely do school. So that's why our actions today, right now, will determine what school even looks like. And so we need to get the gains that we have achieved. We can't rest on them, but we need to aggressively and fiercely protect it. And that will involve universal masking and distancing. Thank you.
Can we talk about the new health regions?
Yeah, sure.
Because I think that's important today.
Sure.
Probably folks are going to be in the collar counties say, great, we're no longer part of Chicago, or we're no longer part of Cook County. But I'm just wondering down the road, if you do have to go backwards, are you also then saying folks from Chicago might travel to these other counties because you can't dine out in the city? Should that happen, I'm just hypothetically, are you also creating perhaps some confusion statewide by adding more health regions?
Here's what I would tell you. People have been traveling between these counties, and we talked about Kendall and Grundy. There are people who live in Kendall and Grundy who travel to collar counties, and just like we were talking about people who travel over the border to go to Iowa or to Missouri or to Indiana. So there's a degree of personal responsibility people are just going to have to adopt. We're setting these regions because we need to be able to monitor properly where there are outbreaks, where there are communities that are in danger, and to make sure that we've got hospital beds and healthcare availability for an outbreak that might take place. So, look, we're not going to stop people from traveling between one county and another county, nor do I like the idea of stopping people from crossing the border to another state. I think people need to be aware, and that's one of the reasons that I have press conferences and have been very transparent about this. I want people to be aware that Illinois has around a 3% average positivity rate. Every state around us has double that or more. One of those states has a 9% positivity rate. So just know that when you go into an area that you need to take extra precautions, recognizing that we have real gains here that haven't been realized in other places.
Governor, we haven't been able to talk to you since the new IDES phone system rolled out. We've talked to a number of people that have been tracking them. That on the first couple of days, they were told they would get a call back in 2 to 3 minutes. It's now been a week or 8 days. Can you talk a little bit about the state's accountability as it pertains to rolling out a system that's supposed to save people time?
Yeah.
And in reality, they're not getting any call.
Well, let me start with this has been an enormous challenge. I think you're aware of that. And I have made myself available for questions, by the way. You have been able to, yesterday, in fact, I was in front of the press, and I've been in front of the press quite a lot. But so I'm happy to answer your questions. This is an enormous challenge. IDES, was overwhelmed. There's just no doubt about it. And I've talked about some of the reasons for that, but that's less important than, how can we overcome the challenges. We have more than 500 additional people answering phones. That's in addition to the people who were already working at IDES that were in charge of answering phones to begin with. And we've moved people from back of the house to sort of front of the house to answer phones. Phones are absolutely, in this ridiculously enormous wave of filings, and don't forget, people have to refile every week, you have to recheck in every week, and to the extent that people are using the phone to do that, or to, in any way to avoid being online, I would say if you can go online, if you can work online to get your filing in to re-verify, for example, or just to file originally, that is absolutely the best way to do it. Not 100% of people are successful at doing that, but quite a lot, because we see the numbers, and literally hundreds of thousands of people, much easier for them to have done that online. As to the calls, and again, this is where, there's no doubt about it, this is where the big challenge has been. I want to solve this as much as anybody. The challenge has been, even with additional people answering phones, that in order for them to deal with your specific case, they have to meet a federal requirement that is about 10 months of training. We haven't even been in this pandemic for, more than 5 months. And having said that, we've tried to take any call that doesn't require that federal level of expertise and move that into a different category and try to get people there. You're asking about callback systems. It's a new callback system. When you talk about, maybe 8 days instead of a few minutes, remember that at the very beginning here, it's very difficult to get, a call in. There's no doubt we have a lot of progress that needs to be made. It's one of the reasons why we reached out and got somebody who's been working employment security for a lot of her career to come in and be the director of IDES. She's already providing great ideas for us. One last thing, and you may have seen this in a Washington Post article just a couple of days ago. Many states are plagued with the challenges in their employment security department in unemployment claims. I just heard from a senator about a meeting that the Secretary of Labor had at the very beginning, letting everybody know that most state systems are not capable of handling what's probably coming. And so this challenge has been, vexing. That's the best I can say about it. And so we've thrown everything that we can think of to throw out. We've gone to outside providers. We've hired more people, we've moved people from the back of the house to the front of the house. It's not that we do it, that we take the applications over the phone less efficiently. There's only one way to do those. It's just that the numbers that come in every day and every week, I mean, we're talking about hundreds of thousands of calls, and it's just, if you think about the amount of time it takes to take an application or even to just answer a series of questions and how many you could do in a single day, if you were working at IDES, it would be impossible to have enough people to be able to answer every call as it comes in.
Governor,
Yes, sir.
cannabis sales are soaring, but the social equity applicants are delayed. How much longer until the Department of Agriculture is finished and ready to award those licenses?
So let me be clear, coronavirus interrupted. There is a set plan, as you know, in the law that said that we would be able to do this May 1. Well, we know what happened between January and May 1, coronavirus. And the result of that has been a massive interruption of what we intend to have happen here. Now, no new licenses are given until these social equity licenses are given. We want to make sure that we're getting accomplished as fast as possible. People of color having the opportunity to enter this industry, to own and to work in this industry. We believe that over the next 6 weeks, that those licenses, I might say, by the way, that if I'm wrong, I'm off by a week here or there, but that we believe that there will be movement on this over those weeks. But it's an absolute goal of ours. We see the opportunity. This industry, remember, there's an opportunity for 500 licenses in total based on the legislation. About 55 of them were granted, before, and now there'll be 75 that will be granted to retailers, and then the numbers of people who will be transporters and cultivators and craft growers and so on. So I'm looking forward to finally getting past that milestone.
Can I just ask you one from my colleague at Nexstar, Mark Maxwell? There's still people in the state that believe the Clayton County Court ruling, major executive orders issued after April 8th, null and void. Do you still believe you have the legal authority to issue coronavirus-related executive orders? Because until another court actually issues a ruling, how can you pretend that this ruling doesn't exist?
Multiple courts have issued rulings. This applies to one person, this ruling that has taken place. By the way, it hasn't even been entered as a final order because the judge held on one of the 3 items he needed to rule on and then went on vacation. So I know that there may be a ruling in the next few days, but suffice to say that even with the final ruling, it only applies to the one plaintiff that was represented there.
So it's your contention you have the authority, you can issue these rulings?
Yes.
Can you talk about the 52 million that has been collected in the weed tax so far? What is that what you expected? And remind us where that money's going.
I looked back just this morning, actually, because I was curious. I think that it's nearly double what was projected. The amount of revenue coming to the state was nearly double what was projected. So very pleased about that. As you know, much of that revenue is focused on social equity, on racial equity, through the R3 program, which is overseen by the lieutenant governor and a committee that includes legislators and others. And of course, police are supported by some of that money, mental health. And then about 45% of it goes essentially to GRF and bill payment for the state. So this is obviously in a moment when revenues have fallen off a cliff in so many other areas because of coronavirus. It's badly needed, and we're glad to see that there's real success in a new industry that we help to create.
Governor, the president today said that next week he plans to announce unspecified federal action to quell violence in cities, including citing Seattle, Minneapolis, and Chicago, once again comparing Chicago to a war zone and saying that they're run by liberal left-wing Democrats. Obviously, we don't know what action he's going to take, but I'm wondering about your thoughts about federal intervention.
Well, it's a sign of desperation by the president to try to to improve his own standing somehow by making these declarations. Look, if he really wants to help, we have violence prevention programs that need funding. We have programs that are intended to provide mental health, that are intended to help kids get jobs during the summer, that are funded by federal dollars. We would love to get that kind of help. I fear that the president is really thinking about other things and not thinking about what really would help. In Washington, D.C., he brought out the National Guard when there was a peaceful protest. That seems, like irrational to me. He's acted irrationally all along, so I can't imagine, frankly, on a day-to-day basis, everything seems irrational to me. This gentleman over here, I'm going to go to one last question because you didn't get a chance to ask one. Yes, sir.
Thanks, Governor. Sort of on that idea, the president also, apparently the White House is now the direct line for hospital transmission data. Instead of it going from hospitals to the CDC, it's going straight to the White House. Obviously, that is, many people are saying that that's reducing accountability. You've got Dr. Zike here, who is part of your team. What do you make of that development at that level?
Well, I'll speak from my perspective. Perhaps Dr. Zike could speak about what the effect on, our reliance on CDC. Look, the president has tried to politicize every aspect of this pandemic. This should not be political. This is about saving lives. CDC is something that public health departments all across the nation rely upon. They've been a trusted source of information, advice, help. And to go politicize it by interrupting the flow of data, I don't know what is the purpose of interrupting the flow of the data to CDC, where the data really belongs and where the experts really are. It can only be political. And that really concerns me greatly because I'm focused on the health and safety of our people in Illinois. I want to get the best advice that we can get. I reach out to epidemiologists. We have some of the best in the world in Illinois, thank goodness. But I also talk to Dr. Fauci and others to get the right kind of advice to keep people healthy and safe. But CDC is one of those places that you want to rely upon. And then when you see a president politicizing, interrupting data, intervening, it gives one pause. But perhaps Dr. Zike has a different perspective.
Definitely not a different perspective. CDC is our foundational public health entity, not just in this country, but serves as a leader throughout the world. I'm on the call with representatives from the CDC on a regular basis. Dr. Redfield has reached out to me, has taken my calls consistently. We've had dozens of people come from the CDC to help us right here in Illinois to support us with this effort. We send our data, our hospital admissions data, directly through syndromic surveillance, directly to the CDC. And just last week, I had a call with people who are looking at that data and telling us other ways that we can look at the data so that we can make sure we have additional clues to identify, outbreaks or anything that may escape detection. I would be very concerned and fearful to move into a new situation where the CDC does not have that ability to intervene and support the states as it has been. We also want to make sure that we have data that we can trust and that we can use to make sound decisions going forward. And there's never been a question of that when we share all that information with our public health foundational champion, which is the CDC. So we will continue at the state level, and I'm sure all state departments will continue to work so closely with CDC. And we are hoping that we will come to a point where we're all working together for the same goal of trying to achieve the health and safety of the people of this country.
So, but can you trust that CDC information now, if it's being routed through the White House?
So I can't speculate on what is going to happen. I just know that we've had a great relationship with the CDC, our trusted source and our public health authority, and we hope to continue to be able to work with CDC in that manner.